Nysa Therapy Incorporated presents Healing Personality Disorders. Course number 2, Nysa Techniques. Lesson number 1, Preview.
It is ethically and clinically appropriate to seek supervision or consultation before using any new technique in your practice of psychotherapy. Please contact us at nysatherapy.com if you would like to receive guidance from our highly experienced consultants.
Here is Dr. Stephen Diggs, Nysa Therapy founder and director.
Hey everybody, welcome to our course on technique. This is course number 2, and this is the preview, an introduction to the techniques we're going to be showing you throughout this course. So our first course was called Integration, and it was a lot of theory, a lot of explanation, but now we're getting into how you do therapy, what you do. But before we do, I'm also going to give you a little bit of talk, a little bit of context about what technique is about in our world at Nysa. The first idea I want to start with is that relationship and technique are equally important. And what's important about this idea is that, over the past 20 years, probably since relational principles have become involved in therapy at a higher degree, there's been this discussion over whether relationship is more important or technique is more important. And people who were highly technical, like solution-focused people and CBT people, cognitive behavioral people, tended to think, well, technique is more important. And then the relational therapists coming out of the feminist tradition and into psychoanalysis, they're saying, well, relationship's more important. Then we have Michael Lambert's research, which says that relationship is most important. And that's important to us. We want to know that. But we also want to give you this idea. What if we make relationship building technically very, very good? Instead of just acting like relationship is this easy, natural thing that anyone can do, what if we say, no, building a clinical relationship with a patient is a technical thing as well? That's where we're headed. Now, technique is important too. And think about this. If relationship was enough in therapy, if relationship was all we needed, everyone's best friend would be their therapist. Because you have a great relationship with your best friend, and that relationship then should be enough to make them your therapist and solve your problems. We know that's not true. There's two best friends talking it out, and they are not going to be able to heal each other as therapists. Why? Because technique is what distinguishes therapists from other caring people. You have a relationship with your best friend. You have a relationship with your sibling. You have a relationship with someone you work with. All those relationships are important, and the people in them are caring. Why aren't they therapists? Because they don't have technique. So, technique is important. Here's a bizarre little slide that I happen to like for some reason, where we have this very caring doctor helping this very sad person who's sitting on the floor, and he's caring, he's got his hand out, he's touching him on the shoulder, but he's also got pills for him. We want to be building beautiful marriages between relationship and technique, which are not powerful alone. But when we marry them together, they become stronger. Relationship isn't enough. We have to have technique to make us therapists in the first place. So let's put those two together, let's marry them and make something happen. So, it is unwise to be good at one and not the other. If you're very good at relationship but you have no technique, you're a best friend. If you're very good at technique but not good at relationship, then unless you're Milton Erickson and you're a genius, you're not going to be able to help the person near as much as you need to, because they need that relationship. What is the wise thing to do? To be good at both technique and relationship. That's what we're going to be talking about a lot as we go through our technique session. So, the next idea. Technique has suffered being isolated. When you have one technique that psychoanalysis uses, and another that solution focus uses, and another that cognitive behavioral therapy uses, those are all good techniques, but we're going to show you how much better they can be if they were integrating with each other, if they were combining with each other, if they were learning from each other. And, you know, I go to a lot of conferences, and I have to say, I see a lot of presenters who advertise themselves as belonging to a specific approach or school of therapy, cognitive behavioral, solution-focused, whatever. And then they get up and they start talking, and you can see they've been borrowing from other approaches. They've been taking things. And sadly, a lot of them, I'm sorry to say, don't give credit to the other schools, the other approaches that they're taking things from. But there they are taking and integrating, and of course, because they're looking at what they're doing and saying, oh, this other technique really fits in with what I'm doing, and it makes it stronger. That's what I want to do, is make it stronger. So first, let's talk about what technique is. Technique is the thoughtful and precise use of skill and knowledge to relieve mental and emotional suffering. Thoughtful and precise. Now, your best friend can be empathetic. Your best friend can be caring. Your best friend can do those things probably really well, in many ways better than a therapist might be able to do them. But they can't use that care and empathy in a precise and thoughtful way to have an effect on your suffering. It's more a general thing. They say, oh, you're such a good person and you're so smart. I know you can figure your way out of this. I have confidence in you. I believe in you. Those are very good things to get from your friends. But what we're going to show you is how to use that caring and empathy to get an exact effect on the insecure attachment that personality disordered people live with. Thoughtful and precise. It's also the use of skill and knowledge. These techniques were developed over time. They were based on the ongoing growth of knowledge in a particular approach or school, and they developed into a skill, right? They developed into a skill. So I've done some, construction on my house from time to time, and I'm not bad at it, but I certainly don't have the skill, even close, of a carpenter or a contractor who does this every day and has knowledge to back him up and has solved countless problems. And that's what a therapist should have, is knowledge and skill that have been developed over years and years and years that allow them to use that relationship they have with you in very skillful and precise ways to make something happen, to relieve your mental and emotional suffering. So this is a very important idea, that technique is extremely important to psychotherapy. And we've got to keep getting as good at technique as we can, as we are trying to get as good at relationship as we can. We've got to let both of those things spin out. Relationship and technique. So, in case you're a little confused about what technique is, let me give you some specific techniques from certain approaches to therapy. Traditional psychoanalysis, they use interpretation. So the patient will be talking and they will say, well, that's an example of your fear of vulnerability. Right? Relational psychoanalysis uses self-disclosure, and they'll say, yes, I have a similar issue with myself, and I've resolved it in these ways so I can relate to how you're struggling right now. CBT replaces automatic thoughts. So you ask the patient, what do you think of before you get anxious? And they say, well, I think that I'm just not good enough. And you say, okay, well, let's give you a thought that's more realistic and that you can believe stronger. And we'll replace that old thought. That's a technique. Psychodrama moves between chairs. Sit in this chair and be the person who's angry. Sit in that chair and be the person who's sad, and let those two have a discussion with each other. Classic technique. Client-centered therapy does reflective listening. And the patient says, I just feel really hurt and sad that my husband would do that to me. And the therapist says, yes, I hear you saying you feel hurt and sad that your husband would do that to you. Yes, I do. Technique. Strategic prescribing the symptom. The patient comes in and they say, I have a problem worrying. First case I ever did was prescribing the symptom. 1979, folks. And this woman worried a lot, and my supervisor told me to go in and have her pick a 15-minute period twice a day in which that's the only time she would worry, and she would compact all her worry into that, and the worry disappeared. It's a very good technique. It's a little shady, so I don't like to use it much anymore. But there it is. So, technique has suffered being isolated in each of these approaches. For example, psychoanalysis is deep. Psychoanalysis is technically an approach to treatment that can go very, very deep. Strategic is fast. It can work quickly, like prescribing the symptom. That's strategic, right? The problem with psychoanalysis is it takes a long time to do that, a very long time to work. The problem with strategic is it doesn't go very deep most of the time. So here we have these two approaches, one that is deep but takes a long time, one that is fast but doesn't go deep. Well, isolated, they've got some serious weaknesses, but what if we integrate them? We integrate relationship and technique, and we also integrate techniques from different approaches. We're going to integrate psychoanalysis with strategic, for example, and try and make something that goes deep and fast. Now, one of the things we use a lot at Nysa Therapy is parting out, and it's a very particular approach to getting at some of the parts of the personality, the critical parent or the hurt child, right? We'll want to part them out. And to do that, we'll use psychodrama chair work, in which we'll say, okay, let's imagine that this part of you that feels very hurt, the hurt child, is separating out and sitting in that chair. We're going to move you to that chair. We use solution-focused esteem. And that is when that part is talking about how they've struggled and how they've survived, we will esteem them and praise and compliment and say, look what you did. That's very impressive. I'm very impressed you were able to do that. And then finally, we'll use relational empathy, in which we'll say, I'm very sad and sorry you had to go through this. We'll connect. We put the three of these things together, and we have a technique that works really well. And it was never going to work that well if we tried to do each of these things separately, but instead they're put together into a single technique. 3 techniques become 1 technique through integration. So, integrative versus eclectic, a last little thought for you because some people are confused. Eclectic therapy uses techniques from different approaches, one after another. So I'm going to start with this and use that till it doesn't work. Start with reflective listening, for example, and then I'm going to move into CBT, automatic thoughts, and then I'm going to move into esteem, solution focus, one after another. Nothing wrong with that. It's a good way to do therapy. But, there's the toolbox, right? But, integrative we think is a better way to go, because in combining different techniques from different approaches into a single technique, we get the weave effect. We get the loom effect. These threads, which were strong on their own, are now much stronger when they're put together. So, at Nysa, we use mostly integrative techniques, but not always. We want to do what works, so occasionally we will use a single technique from an original approach. So, for example, we have a patient who is in a dysfunctional family system, and that system is accounting for a big hunk of their symptoms and their pathology. And we're having trouble helping them get well as long as they're caught in that family system. Then we might say, we've got to do a straight ahead original family systems intervention to break up the way that dysfunctional system is interfering with our patient's progress. In this course, you're going to hear about our main techniques, the ones that we use in most of the cases. And we have a handful of techniques that we use over and over again. But you're also going to hear about some additional techniques that are specific to each personality disorder. So, for example, in the schizoid defense, the schizoid personality, having a relational intervention is very hard to do because the schizoid is so detached from relationship. That's their defense, is to detach. But they're also very easy to get along with. That's one of the ways they survive, is to kind of do what everyone asks them to do, right? And so we have a technique where we'll say, what do you think I feel about what you just said? Well, I don't know. Because if you ask them how they feel about their situation, what they just said, it's hard to respond. They don't know feelings. They're not connected to them. So let's start with me. And we get them started guessing what we feel so that then we can turn it around and say, so what do you think you might feel? We only use that with schizoid, but that's what's necessary to work. So you're going to hear that as well. If you slog through all this talking, next is we're going to start talking about specific techniques, and we're going to show you how to do Nysa therapy and how to heal personality disorder the way we've learned to do it.